Hello and welcome to Health and Wellness, your guide to the integrated personal and financial retirement journey for physicians. I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. Welcome back to the Health and Wellness Podcast. Today I'm lucky enough to have Dr. Michele Knox, a recently retired physician, joining us here on the podcast. She's going to share a bit about her unique experience in her retirement journey. And she served in a variety of leadership roles, including department chief, and has now entered retirement. So, Michele, welcome to the podcast.
Thank you for having me. It's a pleasure to be here.
Absolutely. So, starting out, we talk about the retirement journey, and I'm wondering if you can just give us a broad storyline of your transition from practicing physician into retirement.
Sure. So I worked essentially my entire career with a very large medical group, a health maintenance organization. So I was a salaried physician with benefits and retirement benefits. And the norm is that full retirement age is 65, but there was an early retirement option with no reduction of benefits at 60. So all of us essentially who stay with the group for most of our years are looking at either that 60 to 65 window. There's certainly people who work longer because they love what they're doing, and that's their purpose and meaning. I think for many of us who have other interests and definitely want that retirement phase of life, that was the plan that I was on. And so I expected that I would continue to keep working till I was 60. And what happened to me at around 55, 56, one of those years, is I started to have issues with my hands. And I have arthritis in my hands. My clinical work was as an ophthalmologist, and it became very difficult for me to continue to do what I was supposed to be doing with patient care. So I am now retired. I retired about 3 years earlier than I would have originally expected if you'd asked me 5 years ago. And as a result of the disability process, I had this really sort of gentle ramp down from work. As the medical issues began, I sort of had to narrow the field of what I could do as an ophthalmologist, doing less procedures with my hands. And then eventually got to the point where really all I could do was telehealth. And telehealth for ophthalmology is fairly limiting, as physician listeners would expect. And as I then really embarked on that disability process, I was on a leave of absence for most of the year before I actually separated and formally retired from the group with disability. So that made a very different ramp down from clinical practice, from leadership and administrative roles to being retired. And I can say that that journey definitely had some ups and downs to it. But now that I am retired, I am certainly pleased with my place in life, and good financial planning and some coaching along the way definitely made the transition so much more smooth than it might have otherwise been.
Excellent. And just so everyone out there knows, our relationship began in the physician development coaching program, but this is not a paid promotion, but hopefully just a valuable insight into the combination of strong financial planning and strong coaching across this retirement transition.
Indeed.
Absolutely. Okay. So as you mentioned too, this transition into retirement was a bit more gradual than what I think historically has been the norm, which was a bit of a retirement cliff. In the past, retirement has been perceived as this working full force, solely focused on the career until the day you retire, and it's a professional cliff. So, could you share a little bit about what in your experience made that transition a little bit more palatable as it developed over time?
Yeah, well, the probably more significant piece than the disability was that I am married to a wonderful man who is 7.5 years older than I am. And he retired a couple of years before I did in 2020. And so as he was approaching retirement, I started to reduce my schedule from a full time to an 8/10 and then eventually to a 6/10 schedule so that we had more time to do things together in his retirement. And that began my ramp down. At that point, about half my time was in leadership administrative roles. And I had a fair amount of flexibility in terms of how I could do that, from where I could do that, particularly since he retired just as the COVID pandemic and all the shutdowns started, and all of that work went virtual. There was no longer a discussion of my commuting to a meeting that might be an hour each way because nobody was meeting in person. So that leadership and administrative work had a lot of flexibility to it. And that was really the initial sort of view that I had that I was going to continue working like that for a number of years after he retired till I hit that magic age. And then with the disability, I ended up stepping back from the clinical work before I finished some leadership administrative work that I was doing. And then, as I said, with the leave of absence and full retirement, it was a very gentle ramp down compared to the car commercials always talk about 0 to 60 in how many seconds. And I think a generation ago, many physicians did go, full tilt and then stop. And that was the sort of retirement cliff that I never had anticipated that I would do. And just mine became a little more stretched out or a little shorter, depending on which way you look at it with that ramp down.
Yeah, and that's, I think, very powerful. And a follow-up question to that, as you went from, 1.0 to a point 0.8, I've spoken with many working physicians in their mid-50s, early 60s, who have said that is very difficult to the point where healthcare systems are implementing 90 or 180-day notices for taking time off. Sabbaticals are being forfeited or paid out in cash instead of being taken. And it's such a learned behavior to stay full force 1.0 all in. And these time offs or reducing FTEs can pose a significant threat to the career. So could you share a little bit about what drove your confidence to make that change from the 1.0 to the point 0.8? And then beyond that, what that experience was like for you as an individual?
Well, it's interesting that you frame it that way because a lot of it obviously depends on the group you're with and how staffing is and how long it takes to recruit, those types of things. I actually did do a little bit of a reverse step because I was intending to get from my point 0.8 to point 0.6 just as the pandemic began.
Okay.
And I actually became the COVID person for the regional group that I was supporting with operating rooms and perioperative care. So for a couple months, instead of reducing, I was working full time because at that point, guidance was constantly changing. And what are we doing today to take care of patients
Yep.
safely? And that might be different tomorrow, but we'll deal with today. And so there was a period of time. Again, it's just what were the demands of the job and what was what was needed and for the group as well as myself. I actually would never wish the pandemic would have impacted us the way it did, nor do we ever want one again in that same way. But for me, towards the sort of known end of my career as a medical event, it was fascinating for me in the sort of leadership role that I had because all of a sudden there was a lot of new stuff and I met people in different areas that I would not normally do much work with as an ophthalmologist with infectious disease, infection prevention, infection control. So it was very intellectually stimulating, and that continued on into the pandemic really for a number of years. At first we shut everything down and then we open them up and we get back to normal, whatever that now looks like. So there was a lot there for those last few years that I was working.
You mentioned too the intellectual stimulation of the career, and I just want to
Mhm.
thank you first for sharing that insight into the COVID pandemic because I'm sure it will be extremely relevant for many physicians who both chose to end their career in spite of the pandemic or because of the pandemic, and
Yeah.
others who maybe had this revitalization and re-engagement.
Hmm.
So I appreciate you sharing that insight. And then looking ahead, with that intellectual stimulation that the career provides socially and psychologically, right? It's both people and the complex nature of the career in medicine. What have you found in your retirement to replace or to reapply your knowledge, wisdom, and ability to care for others after practice?
Yeah, so that's where the coaching piece came in for me because I was a coaching client in my last couple of years working. I had really sort of shifted some interest and energy as I was doing less clinical work and simpler clinical work to other things. And I found this and the CME that's offered now through coaching programs to keep us as more highly functioning humans than we might be
Yeah.
otherwise in a very challenging occupation. Um, and it really resonated with me in that what I enjoyed most out of my leadership and administrative works was actually not so much doing large projects or driving change. It was the mentoring and the coaching that I found myself in those roles with
Mm,
others.
mm.
There were early career physicians, or as I became more established as a leader, there were emerging leaders, there were new leaders, there were new department chiefs that I was supporting in a mentoring and coaching capacity. So as I was working through this disability process and realizing I am now retiring a few years earlier than I expected, I still have plenty of energy. My brain still works pretty well, even if my hands don't. And how can I continue to be engaged and contribute? So I decided to try with a shorter program before committing to a longer coaching certification program, that these were skills that I wanted to develop to then be able to use in my retirement to be able to contribute and do my bit to help make the world a better place.
Well, it sounds like you found a phenomenal role that served your purpose, your expression. And I love the language you had in there too. I found myself in that.
Mm-hmm.
So that same trajectory or the same application of your skills that you found in your career of coaching, mentoring, building, you use the word support, and I love that because it's not a coach up ahead creating a vacuum necessarily for someone to grow up into, as much as it is meeting someone where they're at and providing that framework and space to develop into the best version of themselves that they can be.
Right. And it's funny because I had an email exchange with a very dear colleague friend yesterday and, remarked what I was now doing. It's a new year and I have this certification. And the response back effectively was, I'm laughing that you got a certification because you were already really good at this. It was sort of the intent of that. And that is a wonderful piece to have. And it has been very satisfying for me to nurture relationships with others through my career and see them emerge into their own leaders and their leader personas and see all the great things that they're doing. I was blessed through my career with a number of wonderful mentors and coaches. Um, and I just see that there's incredible value in that. I don't know how I would have got through my career without those people. And if I can do something to help others get through their career in a similar way, I would be delighted.
And that is a very powerful observation. I think what I've heard many times is especially for career physicians who are now entering the latter stages, They got into medicine with one expectation, to serve patients, obviously intellectually capable, emotionally showing up with their heart too. And the nature of healthcare has changed over the course of their career. We can
Hmm.
say a lot with a few words there. And so, this coaching piece that you got to experience first as a client and now as a coach provider, how has that served you in your transition into retirement to reapply that same maybe altruistic approach to serving others?
So it allows me to help other people navigate their lives, their careers. And the coach work that I am doing is largely on a volunteer basis. Those financial plans, I feel very fortunate to be the position that I'm in, that that's not a big driver for me at this point. And so it allows me to direct my time, energy, and attention where I think it will have greatest value. Through my medical school alumni association, I started doing practice interviews for the residency match with fourth year med students. And through uh, university alumni level association, mentoring again on a volunteer basis. And I have been matched with a PhD graduate. I've been matched with an MHA, yeah, health administration graduate. Um, and what I realized is that early career trainees look for mentoring to try to find a path forward. And they're already incredibly capable people who have done so much. And it's really coaching that is the support that will help them get past whatever stories might be in their head as to why they're not quite who or where they want to be. But they absolutely can be. And I think that there's clearly differences between mentoring and coaching. But there's so many mentor programs out there. It's an easy way in to find people who really benefit from the coaching portion of the skill set.
Yeah, and I really appreciate that you drive a very strong divide between the mentoring piece and the coaching piece. And let's include maybe advisor over on the mentor side of things.
Mm-hmm.
So,
Mm-hmm.
as many of the listeners know by now, I am a certified physician development coach who works with retiring physicians, but I'm neither a physician nor retired. And so the question is, how does coaching differentiate itself from mentorship? And maybe you could speak to that a little bit.
Yeah, well, mentoring is the obvious one, and I mean, I recently read some lovely descriptions, and mentoring is often about helping somebody early in their career sort of find their path forward, or even be more like the mentor. And clearly, in medicine, there's a strong place for mentorship to trainees, to new physicians. How do I send this patient to neurology? What do I do? And, how do I sort through that? Whether that's advising or mentoring, that's clearly not coaching. Um, but coaching is really letting the wonderful elements that are already inside that person come out. And I think about one of these young women that I got paired with in a volunteer program who wanted to improve her confidence, speaking up in meetings, clearly wants to move on in her career and, move to a manager position, but is very uncomfortable speaking up in the group and was able to bring up the words, I have imposter syndrome. And it's like, okay, you actually don't need a mentor. You need a coach to help you unpack what's holding you back from speaking up and, trying to put aside that voice that is saying, oh, what will everybody think of you speaking up, to having the courage to do it, and then the confidence will come. So that's very much what I see as the difference.
So mentoring and advising being a little bit more, I've been there, I've done that, and I can give you the answers versus
Yes,
coaching. I see
yes,
you, I hear you. Let's explore what answers you've already got.
right. And more asking with the coaching, almost always asking great questions as opposed to telling whatever the answer might be.
And so let's flip that now. Let's turn that application to the retirement journey.
Mm-hmm.
I guess maybe talk a little bit about that stifling. You mentioned the coachee that you were working with has the imposter syndrome. It's maybe self-inflicted to some degree through just learned behavior over time. And we're all absolutely conditioned by our environment. But let's talk about the role that these changes in healthcare over the course of a physician's career, what effect that has on their sense of agency as they sacrifice more and more for their career and the value of coaching as physicians near the end of their careers to reclaim that agency that they have inside themselves to direct their life path forward through the arc of their career and into their retirement. Is that something that you've seen either in your journey or with coaching clients that the career has had an impact on that for an individual?
Yeah, and I think my work with early career and learners has led me to really understand that the medical environment and training, as a side effect, puts in a lot of negative voices into physician heads. And having worked with a health maintenance organization for all my years, I mean, the power of moving early interventions upstream is
Mhm.
huge. So, can we get coaching skills into the early career physician mindset so that there's less of it towards the end? And I think that for somebody approaching retirement, um, there's a number of sort of different views that people have in the world. Some is, I can't wait to retire because they're probably a little on the edge of what's been called in the media burnout.
The big B
And,
word. Yeah.
not that I'm counting, but I have this many days left. So that's one piece. And the other is that there are certainly physicians who continue working into their 70s because they just love what they do and they don't know what else they're going to do. That's fabulous if that's truly what they want to be doing. Like entrepreneurs in business might well work into their 70s. They just love what they do and they don't want to stop. And I say, well, that's great. There's all kinds of people in the world, and isn't that wonderful? I have had plenty of other interests in life, and certainly would not want to work longer than I felt was right for me. So I think the whole sort of idea about agency, yeah, it sort of gets built into a medical mindset that there's all these other demands and those should come first. Um, and coaching is definitely a piece that will help people figure out, well, what do you really want?
That's excellent, Michelle. What do you really want? And I wonder, when was the last time somebody asked you that question? Not just you specifically, but for coaching clients, for
Yeah,
pre-retirees.
yeah,
What do you want?
yeah. Well, and it's just not a question that's asked a lot in the working years of a medical career. I mean, my leadership journey was I sort of got tagged to do one thing after another. And sometimes I was doing something, it's like, I don't know if I'm really qualified to do this, but okay, I'll give it my best shot. And there came a point where I realized it's like, well, actually, what do I want to do? And do I want to work full time? Do I want to start to reduce my schedule? Do I want to look for what are those things that are going to keep me fulfilled once I stop work?
Where did you find that question where you gave yourself permission to ask yourself, what do I want?
So I think I had started that journey before I first met a coach. I definitely learned it much more effectively through working with coaches. And Also, with my second husband, we had an opportunity for a reset in terms of what did I want to be doing with my life? How long did I want to continue working? Um, he's a few years older, and I didn't feel that he should work until I choose to retire. We're different ages, we have different lives, and so that probably was the point in time at which I really started to think more about, what did I want for me? What did I want for us? What do I want for my kids? And how do I also step back from my kids, that actually what I want for them is really not their life. And they get to decide for themselves what they do, how they do it, and spend their time and so on.
So the theme that I heard there from that entire response was I was a coach at heart before I even met another coach. I was coaching myself. What do I want? Providing myself that agency. You started working with a coach, that became clear. And now you're offering that same gift to your kids, asking them to ask themselves, what do they want out of their lives, rather than projecting that onto them. I think that's phenomenal insight.
Well, you said it beautifully, so we'll leave it there.
Well, thank you. So I think this is a really good spot, Michelle, to pause. We'll wrap up the first of a two-part interview here. Any closing words here on the first part of the conversation for retiring or retired physicians, as far as your takeaways from this half of the conversation?
Well, I'll use the word that you brought up, and agency. We all have choice. And it is very easy to forget that in the middle of a busy day, a busy week, a busy practice, a busy life. And yet, if we are not true to ourselves, then we're not really living that best life. So we have choice, and staying focused on what do you want is super important.
Wonderful. Well, thank you so much, Michelle. We'll have you back next week for the second half of the conversation.
All right. Great to see you, Michael. Thanks for having me.
Thank you. Thank you for listening to this week's episode of the Health and Wellness Podcast. As always, I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. If you're looking for additional resources for integrated physician retirement planning, please visit healthandwellness.com. We'll see you in the next episode.